Good evening, everyone. It's a pleasure to be here with yourselves tonight, and we will be talking about the principles in addiction treatment. And we are thankful to our professor for being with us. We have national and international participants tonight, therefore, we have simultaneous interpretation that will be present. And for that, you need to click on the globe button on the Zoom menu. And from there, you can select the language. If you cannot see the globe icon, then there are the three dots on top of each other, and you can see it from there. So without further ado, we give the floor to our professor. Hello, everyone. Thank you for being with us at this hour. We have national and international participants, therefore we have different time zones. And you know the topic of the evening. It's a global application that we will be talking about. And I will be sharing a presentation. And if you allow, I will begin by sharing that presentation. The presentation slides are in English. I will continue in Turkish. So we will talk about the principles in addiction treatment, but we will also talk about innovative interventions. It's, of course, very difficult to talk about this topic, this vast topic, in 45 minutes. But as I said, I will go down to the basic principles. Everything that we will talk about here would probably be based on hundreds of literature publications. I will not go into their depths, but you can be sure that everything that we talk about is evidence-based, but I will try to simplify them in a manner everybody can understand. So, what's the basic question? What are the causes of addictions, risks, and needs? We begin from there. But there are so many factors, it's very difficult to address them all. Therefore, I prefer to categorize to make it more understandable. One is physical, which includes genetic issues, and we, in the recent research, see that this is almost up to 50%. So this does cause a significant risk in addiction. Addiction tendency doesn't always, of course, materialize in everyone, but it's there. What are other issues, causes? Family. Family, we will talk about, of course, but in summary, there are two sides. One is the neglecting family, and the other is the overpossessive one. We will talk about the details later. Then we have the environment category. The environment that the person is in establishes many things, as we all know. And now we can access a lot of things in all of our environments in our daily lives, but it's not just the environment, it's our friends, it's our acquaintances. And another category is psychological. What can that be? Depression, anxiety. That can be a significant factor. Mental trauma. 80% of the time we see that. And that is very important for us in the treatment. It's a very important input. Sometimes there are psychotic thoughts that cause addiction. And then, very similarly, and as important as family is personality. The borderline personality, for example, where there are secure attitudes that are lacking in people, they can be causes. And of course, every borderline doesn't have an addiction, but nevertheless, these are categories that create risk, especially when a couple of them come together. So, and the structured daily routine is another category. People having too much free time. By 90%, we see that addicted people have large free times, lack of nutrition, not sleeping well, not having a routine in daily life. We are tending to see addiction, and sometimes it happens with attention deficit. And sometimes some category risks come together, and that even increases the possibility. And it's not just about beginning the addiction, triggering it, but also continuing it and prolong it. And we need to identify these so that we can address them during our treatment. But of course, change takes time and it's never easy. People don't just change overnight. We don't lose weight in one day. It takes time to change our diet, to make that decision, to continue it. It's a process. Therefore, change here is a very important factor. And of course, people need to want that change. And what does that actually entail? They need to be ready for it. Change happens when people really want it. People who are overweight, if they're not ready for the change, they don't lose weight. Smoking makes them cough, but they're not ready for the change. They don't give up. But when they are ready, then they can do the change. And this is valid for all types of addiction. Therefore, change is a very important factor in our treatment process. Questions are coming along, by the way, but I'll try to respond to them at the end so that we can address them all together. Two things create the change. Change needs to be important for the person and feeling confident for the change. When the two come together, change happens. This is very important, being ready and feeling confident about it. Again, with smoking, not just coughing makes you stop. Similarly, with alcohol, with gambling, you may be getting a lot of support, then that change might not be very important for you. And sometimes people want the change, but they don't feel confident about it. Life needs to change. They need to get away from things that provide them a feeling of joy. And if we don't feel confident about that, then again, change doesn't happen. So we need to look at these two issues with people as well. Change is really difficult. Look at yourself. Do we change easily? Do we change our lives easily? No. This happens when we want it and we feel confident about it. That's why we always stress these issues. we try to increase the importance, and we try to increase the confidence. But sometimes people don't still want the treatment. They don't come to treatment very easily. And this really happens quite slowly in addiction. So, what do we do? Don't talk to them alone. Talk to them in as couple of people, because when they are alone, people are more resistant to change. But when there are a couple of people around, then people might feel more confident, and that could create a more tendency to change. And of course, there are other factors. Everybody wanting me to change actually creates a feeling of importance for the change. Why did I choose this train figure here? Sometimes you see people sitting along train racks, and they are desensitized to the sound, to the disturbance, but a person who's new there notices it very quickly. Therefore, talking about this issue too much and too often desensitizes people. They don't hear, they don't take it seriously, and they just say, oh, yes, yes, and they move on. Therefore, too much and too often preaching is not preferred. A mother, father, or a spouse saying this constantly makes the meaning diminish for people. But when you do it more rarely, then the impact is higher. But of course, close circles for people, they worry and they therefore repeat quite often. But unfortunately, this might not work. Especially as professionals, we need to at least be aware of this. And don't make the process and life for this person easier. For example, a person drinking too much one night and not being able to go to work the other day is managed. And then they don't feel frustrated. And then they don't change. They need to feel the responsibility of certain things. For example, a teenager drinks, comes home, throws up, and mom and dad comes and cleans and soothes, and they sleep and wake up and everything is forgotten and gone. But if they were the ones to clean and put up with that, then they would maybe at least think twice. We don't want to make life difficult for them, but we don't want life to be easy for them because of that addiction. Again, this is for the importance of change. People need to feel that their life is difficult so that they can feel the need and want to change. And sometimes they can't stop, even if they want to. I have many clients, they say they don't want to, they don't enjoy it, but they can't stop. And they say they don't know why. This is a completely frontal cortex issue, a brain issue. At this point, blaming and criticizing this person is no use because they can't help themselves. And at this point, hospitalization is actually a good option because when you see a person continuing, even with all the negative impact, they continue and they can't stop after a couple of years, then hospitalization becomes quite important, because then we need to do something else to stop that brain. After the hospitalization, of course, the control will resume back with the person, but still the hospitalization at this first initial point, it could be really, really beneficial. So when you suspect, what do you do first? First, don't hide it, don't ignore it, because this will feed the addiction. We see this in our experience all the time. Ignorance feeds the addiction. Therefore, talking about it, sharing it is very important. And it also disrupts the relationship, ignorance and hiding. But of course, don't accuse or don't judge. How could that be? You can openly say, I'm worried, I suspect this, and I'm really uncomfortable. But if you say, I know you use, and you're hiding from it, and that's not good, then this person will start the resistance automatically. So we don't hide it, we don't ignore it, but we sit down and talk, and we share our worry without accusation, without judgment. As I said, share your concerns without judgment. This is very important, because when you point your finger, then it will create resistance. But if you say, I'm worried, then it'll cause a different reaction. But first, get informed. The internet has a lot of information now. Read and be informed. Be informed more than the addict. Sometimes they know a lot as well, but you need to know as much as they do, because if you don't know, then they won't listen to you. They devalue your words. And of course, you need to seek professional support, because this is really a complicated issue. It's very difficult to resolve. Therefore, professional support is very important. We always see some people trying to bring their addict close friends or family members, but if they're not coming, then you go by yourself to get support for what you can do. I've had clients of sorts in my experience, and some addicts are addicted to very different things, and it still can be worked on, but with professional support. And therefore, that is very important. Even if the addict doesn't come, the person who's worried about this should seek this support from a professional, of course, from an addiction treatment professional. Recovery is a journey. This is something we use very often. What do we mean? Let's look at a timeline. First, we need to begin with a readiness to change, as we talked about. Without that, treatment is not beginning. Then we come to detox. We need to get away from that substance. It's not just chemical substance. It's gambling, internet, we are talking about not using this, not doing this for a month or 3 months. These are all detoxes. And this begins the cessation and start creating the capacity. I say to people for their smartphones as well, detox 2 hours, don't use it. You will feel wonderful. So that's what we say. Second step is detox. 3 is stabilization. So person has quit, but this is not enough. This needs to stabilize. Okay, I was ready, then I detoxed, then continue your life? No. We have to first stabilize. We need to give the body some time. The mental processes, we need to give it time as well for recovery and stabilization. Sometimes people need to stay away from certain circles during the stabilization phase. Then we come to rehabilitation. People need to learn to change their lifestyles. They need to develop their communication styles. They may need to find new friends that are not addicted. They need to learn not to be angry, for example. They need to learn sustainability. And then we come to integration. That's an integration to society, more or less, going back to a job, for example. But if we skip the previous steps, we can't do this integration. What do we do usually? We detox, then go to integration. No, we have to do the rehabilitation, stabilization, and then the integration. And this is a long time. It may even be 12 months, but without them, the possibility of success decreases. Success rates go up to 75%. But you can't skip from detox to integration. So, what is recovery? It's staying clean or sober. It's not just that. It's not just the physical recovery, though. Globally, this is accepted. The staying clean part is actually the beginning, the micro step, because they need to improve their family relationships. They need to participate in life. For example, they may be clean for 10 months, but they haven't gone out for that duration. Then we can't say they are participating in life without the addiction. They need to resolve their mental health issues. They need to change their lifestyle. They need to maybe continue or go back to work or education. Therefore, when we say recovery, we are talking actually about a lot of social aspects. Not using or not doing something is not recovery. Physical recovery in this sense is not recovery for us. Especially recently, globally, this is a new innovative trend. This is a psychosocial recovery process that we are talking about. Sometimes physical recovery happens, but then the social is lacking. And now, recently, we are much more focused on the social. Okay, I'm not using anymore, but I'm still living the same life. I have the same friends. Then it's not going to change. Those substances will enter that person's life one way or the other. Therefore, recovery is a holistic approach and it's a lifetime process. And it will all take time. Effort is required in each step. So, family involvement in treatment is very important. Our research says that seeing the family 3 or more times, it increases recovery by 2.5 times. But unfortunately, in some societies, we can't find the family. Okay, we can't do anything about that. However, if we can find the family, including them, increases the recovery success. And this is not just one time. As I said, it should be 3 or more times. The family has to be in the process. Again, our experience shows us what we need to look at in the family, because working with a family is also very wide scope. There are many factors there as well, but our research focuses on certain topics. One is the attitude of the family to the addiction. The family needs to know about it, understand it, not take it as an enemy, not see it as a weakness. Therefore, the family needs to understand addiction is a disease, actually. Then another factor is family bonds. This family bond issue also may trigger addiction, but it can also create an opportunity for treatment. Then, ability to sign responsibility. Addicts don't take responsibility most of the time. And therefore, the family needs to learn to give that responsibility. Rule setting skills, something I find lacking most of the time. Families need to increase their capacity to set rules. And another factor is conflict resolution skills. This prolongs addictions as well. It causes them. Sometimes people get addicted just because of a lack of resolution as well in families. And these are based on experiences we've had with more than maybe 10,000 families. In many societies, we see codependency in addiction as well. And what that means is one family member supporting that addiction. And this also has many factors, and one is altruism. Whatever this person does, one family member continues the altruism ultimately. And then there's the anxiety. What if this happens? What if that happens? And this also creates codependency. Another is turning a blind eye. And we often see this as well in family, unfortunately, or trying to avoid. Sometimes I see a 9-year-old kid doesn't want to relinquish the tablet, and the families say, okay. I say, why? Then they say the child melts. But then there's the guilt. We did something wrong, and that's why this happened. This also creates codependency. And these are very important factors in continuing the addiction. And of course, one of the important barriers in the addiction treatment is actually codependency. Therefore, we have to look at this. Is there anyone in the family that is creating that codependency? And if there is someone, which factor are they mainly focused on? And then we address this issue as well. Codependency hasn't been taken into consideration until recently, but now it is being taken into consideration, and we are doing so as well. And we find it to be very important. Again, we say recovery is a journey. This is a quite significant research I'd like to share. We see addiction recovery sometimes maybe 8 or 9 years after the beginning of the treatment. And this is very important for us in terms of looking at expectations, because people think that it's like an ATM. You're going to insert the card and get the funds. No, this doesn't happen. We cannot hurry. We cannot increase our expectations. It will take time. It will happen, but recovery is a long process. And this is again another study we have done. And one line is the age of consent for substance use. Age of consent of treatment is the other. And you can see the difference is quite significant. People seek treatment 5 years after they begin the addiction. And the earlier the treatment begins, the earlier success comes. Therefore, identifying it early, not ignoring it, will also shorten the recovery duration. These figures are from Turkey, of course, but I don't think this will be very different from country to country. The average is 5 years for seeking treatment. Therefore, following up on these issues and not ignoring them are very important. Co-occurrent issues are also very important, and they may also delay recovery. For example, depression. This impacts the treatment measures. And when you have depression, you have more treatment interventions. For anxiety, similarly. So with co-occurring issues, some recoveries are delayed. Depression and alcoholism, maybe they will recover after 5 hospitalizations. And if we expect something earlier, then this will create disappointment. Therefore, we need to really understand this. Repeated hospitalization needs to be taken as a part of the process. Addiction is treatable, but also it is a recurring disease. A person may be addicted, then they may recover, then they may be addicted again, then they recover again, then they are addicted again, and this may be a trend. And this disease may have this trend, but our goal is different. This is what we should see. Yes, addiction, then detox, then recover. Addiction may begin again, but let's recovery, let's have it longer. Then the repeating addiction, let's keep it even shorter. Then the recovery even longer. Recurrences will happen. It may happen. But the important thing is to keep it short and the recoveries to be longer each time. And this actually gives people motivation. There are many treatment modalities, as you see on the screen, the individual therapy, group therapy, medical treatment, peer support, occupational therapy, family therapy. We need to do them all. A single intervention singularly does not work. Individual therapy with art therapy, with occupational therapy, they need to all come together because addiction is a multi-modality disease. We have new treatments in addictions, TMS, the severe cravings, smoking, co-occurring mental health issues, especially in the recent years. TMS is shown to be used in addiction, but of course it has to be at the right time, with the right person. Ketamine infusion, this could happen, and if it is done properly, we know it can be effective. Sometimes people in recovery tend to have maybe depression, then this could be an option. So this is a rebuilding process, and we are filling the gaps. And we will continue this for a long time, and then the person will be treated. So, treatment environment, where should it be? In nature or in the city? It could both be valid. Person will go back to where they're living anyway. So taking them away from the treatment may have pros and cons. I think these two also need to be combined. Maybe nature away from the daily life for a shorter time, but continued treatment in the person's normal daily routine. So, should we have frequent sessions or infrequent sessions? Research tells us it doesn't make much difference. But if the addiction is severe, then frequent meetings are more important, it is said. Families sometimes say, well, you're calling us too often, but not every addiction may need it, but some may need it. It changes according to person and situation. There is no one solution that fits all. Therefore, you can't say weekly sessions for everyone. You need to look at the unique situation and develop a methodology accordingly. And of course, the psychosis. Beware of them. The changing of the substances, that's very important, and they may hinder recovery and treatment. Whenever we see that, even mildly, we need to do hospitalization. We didn't see this too much in the past, but now there are multiple new substances, therefore we see them a lot. The substances change. We're always on the edge. Will that change? Will this come? And it really does. And we need to be alert to new substances. And the basic goal is recovery and staying alive. We want to keep them alive, keep them healthy, at least at a certain level, and then we continue with the process. And now online therapy is a global trend. There are pros and cons, but it's also a big opportunity. And this makes life quite easy for all of us. Maybe not at the beginning. Maybe at the very beginning, we work face to face. We get to know each other. We take a few steps, and then there can be online therapies. Online group therapies are also valid. But from time to time, coming back face to face is also an alternative. For example, in Istanbul, going from one point to another may take 2 hours. Therefore, an online therapy can be a good opportunity. It's just that we need to begin face to face, maybe continue then with online, but then come back face to face from time to time. Okay, the comprehensive assessment. This is actually very important in regard to that individualized treatment. We need to make use of our scales. We need to get the severity of the addiction, the story, and we need to use the reasons index. We need to see the change inventory. Then we can have other diagnostic methods because this will all give us a roadmap to our individualized treatment. Of course, after doing all of that, we need to look at the feedback as well. Globally, it is now much more seen that that feedback is very important. People want to know actually why they're using, what is their trigger. They want to understand themselves as well. And when you make that happen, then change happens more easily. And these tests don't always have to take too much time. These are all our strengths. These are all innovative strengths that we have at the moment, I believe. As I said, we need an individualized recovery program. Our program, we have 36 stops, just like a bus trail. Then we have art therapy. And this is about learning through feeling. We really find that to be very important. Family work in groups, individually, couple therapies, they're all quite vital. And then also group activities that are fun. We don't always have to be very serious. I see a lot of clients saying that this is much better for them than the other types of treatments. And of course, the message is always recovery. Psychoeducation is nowadays vital. This is something we do all the time, and we do that in TMS as well. And of course, other types of treatment methods. Why? Because that's what global trends show us. Then we have to set that roadmap. And we do that with an addiction counseling matrix. This is something we create with the risks and the needs, and then we have the detox. But first, we have to seed our path. And that path is actually allows us to create the individualization. And of course, relapse is a very important risk we have. Therefore, follow-up is very important. And that's why we also have identified a Buddhist relapse index. And of course, that's not enough. We have another index that shows us the process, what's happening. And we use these all in our follow-ups. What did we do? What did we change? What are we lacking? What more should we do? The structured treatment, as I said, begins with a comprehensive assessment. Then we have a roadmap, and then we have a multi-dimensional treatment and monitoring. And this is our program. We call it MOTS, and we can see everything about a person in this program that we have for a person. We created uniquely for it, but the framework is standard. And this is a global trend as well, and we see that it becomes quite effective. So that's all from me. And I think you may have certain questions. Therefore, I'll give the floor to Zülküf. Thank you very much, Professor. It was a pleasure to listen to you. And as you always say, it's important to share. And that's why, as Moodists, we are trying to do this all over, not just in Turkey, but all over the world. Therefore, we have participants from various different countries, and we are thankful to their participation. And we have questions. A participant from Romania says that they've been to treatment in 3 different centers, but when they go back to their life in the same environment, they relapse. And what would you say about that? Never give up. Never give up. Okay, this means there's something missing. But what is that? We have to find that. The Mori index for us, for example, tries to find this. As therapists, we may have missed something. That might happen. There might have been that we didn't do. We have to find that so that we can change it. Sometimes I see it in my client. Okay, this is done, finished. But then they come back with a relapse 6 months later. Then we sit down and look what happens. They haven't been able to manage the stress. Okay, that's something we missed. Stress management. We focus on this time. So never give up. Okay, thank you very much. Another question is, I think, about the work that you are doing, and it's about the success rates. We look at it in periods, 3 months, 6 months, 12 months, 2 years. 3 months, 50%, 55%. 6 months, 12 months, the rate increases, especially for us in Moodist. Therefore, I believe our rates are quite good. But again, this is individual. For example, I did an individual roadmap, but say I don't stick to it. I don't come to my sessions. This will have an impact. And therefore, we ask people, will you be able to do this? And we find methods that they can do, then that also increases the success rates. Thank you very much. We had a lot of questions, but actually you responded to them mainly in your presentation. But there's one question saying, how do I understand if I'm addicted. One thing, functions, psychosocial functions, are they disrupted? Can they go to work? Can they go to school? Am I taking care of my responsibilities? Or am I lagging because of my addiction? Is my addiction a priority? For example, if I'm having alcohol, do I always want to go to places that serve alcohol? Is it for gambling? Do I spend my money to other things or do I spare it only for gambling? Another thing is not being able to stop. And another, using although it is harmful. So these four issues, if you have two of them, then we can say that you are an addict. But of course, we have to look in depth. We have to do an in depth assessment, and that has to be really individual. We need to look at the background, the story, but nevertheless, this can at least give us an idea to begin with. Yes, thank you again, Professor. These were my questions, and maybe are there any participants who would like to take the floor? We have a couple of minutes. Technical team, can we give anybody the floor? Do we have anybody who would like to take the floor? I see Esra. Esra, can you unmute yourself? You can also write if you like, if you are having a problem with your sound. We are unable to hear our participant, Gürkan Toprak. We're trying to give him the floor. Hello, can you hear me? Yes, we can now. My question, Professor, after listening to you is, and I've read about most of them in time as well, but you've underlined many things, and I'm a mother. I was worried about my son, and all the things that you said are not being done in state hospitals. This treatment is not like that in state hospitals, and it's not sustained. But maybe in private hospitals like Moodist, you can do it, but it's quite costly usually. Therefore, this kind of issue regarding economy is keeping people from treatment as well, I think. Yes, you are right. And this is a global issue. Addiction treatment is expensive. And the addiction, you need a lot of professionals. That's why it's expensive. And the state is unable to provide for that, and that's problematic. Yes, there are certain centers like the Green Crescent, and they have programs, they have interventions, but they don't have, of course, medical treatment. And as you know, as you said, there are many problems about this, unfortunately. Okay, thank you very much. We have a couple other questions from chat, and Eleonora was saying that they were understanding addiction better now with this presentation. Thank you very much. Another person is asking about TMS and if that would be more effective without the other steps. Well, we have to do an in-depth assessment. Each treatment, each treatment can actually be harmful. They need to be unique to the person. Therefore, we can't say anything from afar, and no healthcare professional will do that. We have a participant from Chicago, and they're asking if they could stay at the hospital together with their spouse. And sometimes, in special conditions, we may allow that, but we have to look at the in-depth issues. But sometimes, if there is codependency, staying with the spouse could actually be harmful. Therefore, we really need to look at the unique situation. But of course, there are certain people who can really not stay alone. And for that, we may allow that, especially if the person is not able to do self-care or if they are elderly. And maybe we can kind of time the stay. So, as I said, there is no one solution that fits all. It has to be unique. It has to be specific. Thank you very much. And lastly, after treatment, is it important to continue the therapy? You actually talked about it, but maybe you can recap. Sometimes recovery is 12 months. Sometimes it's longer. After the hospitalization, it's not done. We have to continue. Therefore, you say sometimes, yes, I'm recovered. I won't do it again. But then you relapse because you don't follow up. Sustainability is very important. Each step is very important. Fifth month, we see a depression. We have to support the person. And 11th month is a relapse. And the therapist knows these, the client doesn't. Therefore, we need to give that proper support to that proper unique time. And changing the life is between 3 months to 6 months, for example. All these are, we always say, it's a process, it's a journey, and you have to keep someone with you for 12 months. Thank you very much, Professor. I'm looking at the questions. We've responded to many of them in the presentation, and you responded to some of them individually. Thank you very much. Do you have any further comments? No, thank you. Thank you very much all for your participation. I'm also thanking you and everyone for your participation. Thank you for the questions, and it's a pleasure to be together with these events. Thank you very much, everyone. Good evening.